Today, we're going to talk to you about social media and the impact it has on the nursing profession. So, what is social media? Many of us can list examples, including the ones on this slide: Facebook, Snapchat, Twitter, YouTube, Instagram, blogs, Google, as well as Vimeo, LinkedIn, Skype, and many additional ones. But what's the definition? When looking at the definition, social media is a form of electronic communication where users can create online communities. Within these communities, they can share information, ideas, personal messages, as well as other content such as videos and pictures. So how does social media affect nursing? Social media is going to have both positive and negative effects within the nursing profession. We'll discuss those in just a little bit. Currently, social media helps track health trends, and these health trends can be utilized for research purposes. Additionally, it improves communication between nurses and other healthcare providers. And with this open line of communication, it allows individuals to share research and increase networking opportunities. Organizations can also utilize social media. In doing so, they can share policies as well as events with all of their employees. Throughout the upcoming years, social media will continue to evolve, and nurses are able to utilize this change to maximize their own skills, as well as improve the care they provide to their patients and advance the nursing profession. When thinking about social media within the nursing profession, it's important to think about the policies that surround social media. Policies should be in place so that nurses can establish professional boundaries. In addition to professional boundaries, HIPAA training is done to educate nurses on patients' rights over their own health information, as well as who can and cannot look at the patient's health records. Accidentally or intentionally violating HIPAA can result in a $100 to $50,000 civil fine, as well as lead to licensure problems. A common mistake nurses make is posting comments about their patient and/or the hospital. When posting these comments, even if the name of the patient is not used and/or the name of the hospital is not used, the hospital or the organization has the right to fire the nurse for being insensitive and unprofessional. Be sure to always consider your patient's privacy. Reference back to your HIPAA training to ensure that you are not violating any of the policies within your organization. So let's discuss the positives of social media within the nursing profession. Within our personal lives, social media provides the nurse with a sense of connectedness and support. Studies have shown it improves mental health while also encouraging and improving health behaviors. Additionally, the nurse has instant access to health content and the ability to monitor and improve their own health. Social media can assist in continued education for not only the nurse, but also the nurse's patients. When looking at social media from a professional standpoint, the nurse has access to real-time information. What this means is the nurse can research information right then and there with the ability to share this research with others. An example of this is Twitter, which assists in disseminating research findings. 69% of adults track a minimum of one health measure, allowing social media sites to utilize this data, in turn providing nurse researchers with more data for their studies. To add on to the professional benefits of social media, nurses have the ability to develop knowledge and advanced education within and outside the clinical setting. It improves and builds the nurse's personal and professional self-image, while also improving networking between different nursing professions throughout the United States. Social media gives the nurse a voice regarding important professional issues and can also be utilized to link newly hired nurses with other nurses, organizational resources, educational material, while also encouraging self-directed learning for new and existing nurses. As nurses, we should utilize social media to advocate for our fellow nurses as well as our profession. In doing so, we can watch and learn from videos our fellow nurses have posted, read blogs about changes occurring within the healthcare profession, while providing educational material that other colleagues can utilize. Social media should always be used to uplift our colleagues and advocate for the nursing profession. It should never be used to express our frustrations towards any situation or any event that has occurred.
Consequences of social media within nursing. Violation of patient privacy can result in violation of the HIPAA, which in turn can result in suspension or termination of the workplace. Cyberbullying within the workplace can occur from nurse to nurse via photos, messages, and speaking poorly or running down peers. Although there are many reputable sites with information backed up by research, there are also a lot of misleading articles shared throughout social media that have not been backed up by research, which can cause hazardous results. Boundaries can become blurred between one's personal life and one's professional life. Therefore, it's very important to separate the two. One of the primary roles of a nurse is to recognize and exchange emotions, as virtual interactions can alter a person's ability to recognize and effectively respond to the patient's displaced emotions. Furthermore, social media can interrupt and distract nurses during work, causing their focus to sway away from the patient. When the nurse is distracted due to social media, they have a higher tendency to make medication errors, miss critical information within the patient's chart, or during handoff. There are many ethical issues that can arise from the use of social media in the nursing practice. Communication between healthcare professionals and patients is strongly characterized by medical confidentiality, trust, and privacy. Data is expected to be safely stored in the patient's record, inaccessible to others, and even protected by law. Social media can become the new way that improves communication between patients and medical professionals. However, communication via social media is conflicted with a couple of ethical issues relating to the impact of data privacy and security. The main ethical concerns at risk are, again, confidentiality, unauthorized access to computers, uninformed consent, data privacy, data security, and trust. Provision 3 in the Code of Ethics for Nursing states that the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. More specifically, Provision 3.1 states the protection of the rights of privacy and confidentiality. Privacy is the right to control access to and disclosure or non-disclosure of information pertaining to oneself and to control the circumstances, timing, and extent to which information might be disclosed. The nurse has a duty to maintain confidentiality of all patient information, both personal and clinical, in the work setting and off duty in all venues, including social media or any other means. Nurses must maintain vigilance regarding commentary that intentionally or unintentionally breaches their obligation to maintain and protect patients' rights to privacy and confidentiality. The duty to maintain confidentiality is not absolute and may need to be modified in order to protect the patient, other innocent parties, and in circumstances of required disclosure, such as mandated reporting or for safety or public health reasons. The future of healthcare and social media. Proper use of social media may help nurses accomplish holistic nursing care if they can avoid violating patients' right to confidentiality and privacy or compromising the integrity of nurses. The American Nurses Association indicates nurses must know current standards of nursing practice and changing issues. Social media and healthcare falls within the category of changing issues. Social media will continue to evolve, however, for now and in the future, nurses' use with technology should be compatible with safety, dignity, and rights of the people, along with respect to Provision 3.1, which stated the protection of the rights of privacy and confidentiality. We thank you for your support and we look forward to hearing your feedback.